I'm Professor Sam Berkovic from Melbourne, and I'll address the issue of the genetics of seizure aggravation. The use of genetic markers to predict drug response or side effects is known as pharmacogenetics, which is an emerging and exciting field in the broader area of the genetics of epilepsy. We hope that pharmacogenetics will impact on the prediction of resistant epilepsy, the prediction of side effects that occur only in certain individuals, and the ability to predict the individual's drug response, both in terms of their likelihood of getting better, that is seizure remission, or the unwelcome problem of the seizures actually getting worse, or seizure aggravation. What is seizure aggravation? This is the increased frequency or severity of seizures in response to a drug. This has been recognised for many years, but is it a real phenomenon? Well, the evidence suggests that it is, but it is quite hard to measure because we know that seizures vary unpredictably. There are many anecdotes and some case series of seizure aggravation, but it is difficult to measure scientifically and difficult to assess in individual cases. Given this, is there evidence for genetic factors in seizure aggravation? Yes, there is, in a very broad sense. For example, we know that sodium channel mutations that cause Dravet syndrome are associated with a poor response and aggravation to drugs such as lamotrigine, carbamazepine, and phenytoin. Is this an effect of the syndrome itself or a true pharmacogenomic effect? Probably the former. However, genetic testing is essential for diagnosis, but it doesn't really lead to any specific further refinement in the treatment once you've got that far. In a specific sense, there is no good evidence for genetic factors in terms of seizure aggravation, but the absence of genetic factors determining aggravation independent of etiology or in specific patients has not really been well studied. So in conclusion, seizure aggravation is a real phenomenon, but it is hard to measure and easy to overestimate. It is an important problem because we want to identify patients at risk of aggravation before actually giving them the drug that may lead to worsening of their condition. At the moment, there's no evidence of a genetic contribution to aggravation, but absence of proof is not proof of absence. Proper studies will be methodologically challenging, but this is an area now for future research.